Hi, welcome to our YouTube channel. Today we will talk about mental health. What is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and helps determine how we handle stress, relate to others, and make choices. Mental health is important at every stage of life, from childhood and adolescence through adulthood. Over the course of your life, if you experience mental health problems, your thinking, mood, and behavior could be affected. Mental health conditions. Mental illnesses are disorders, ranging from mild to severe, that affect a person's thinking, mood, and/or behavior. According to the National Institute of Mental Health, nearly 1 in 5 adults live with a mental illness. Many factors contribute to mental health conditions, including biological factors, such as genes or brain chemistry, life experiences, such as trauma or abuse, family history of mental health problems. Some mental health topics include antisocial personality disorder, anxiety disorders, including generalized anxiety, panic disorders, obsessive-compulsive disorder, OCD, phobias, and social anxiety. Attention deficit hyperactivity disorder, ADHD, bipolar disorder, borderline personality disorder, BPD, depression, eating disorders, including anorexia nervosa, binge eating disorder, and bulimia nervosa, post-traumatic stress disorder, PTSD, schizophrenia, seasonal affective disorder, SAD, self-harm, suicide, and suicidal behavior. A serious mental illness, SMI, is a mental illness that interferes with a person's life and ability to function. Despite common misperceptions, having an SMI is not a choice, a weakness, or a character flaw. It is not something that just passes or can be snapped out of with willpower. Early warning signs and symptoms. Not sure if you or someone you know is living with mental health problems? Experiencing one or more of the following feelings or behaviors can be an early warning sign of a problem. Eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, inability to perform daily tasks like taking care of your kids or getting to work or school. Do you think someone you know may have a mental health problem? Talking about mental health can be difficult. Learn about common mental health myths and facts and read about ways to help you get the conversation started. Mental health care and treatment. In the context of national efforts to strengthen mental health, it is vital to not only protect and promote the mental well-being of all, but also to address the needs of people with mental health conditions. This should be done through community-based mental health care, which is more accessible and acceptable than institutional care, helps prevent human rights violations, and delivers better recovery outcomes for people with mental health conditions. Community-based mental health care should be provided through a network of interrelated services that comprise mental health services that are integrated in general health care, typically in general hospitals, and through task sharing with non-specialist care providers in primary health care. Community mental health services that may involve community mental health centers and teams, psychosocial rehabilitation, peer support services, and supported living services, and services that deliver mental health care in social services and non-health settings, such as child protection, school health services, and prisons. The vast care gap for common mental health conditions such as depression and anxiety means countries must also find innovative ways to diversify and scale up care for these conditions, for example, through non-specialist psychological counseling or digital self-help. I think you already want to subscribe to our channel. Don't forget to like, comment, and share to help spread awareness and break the stigma around mental health.